everyone, welcome to our channel. I'm Wefafa Andrew, and today we are going to talk about something very special. As I promised in the beginning of this year that I will be bringing people from different fields of medicine, and today with us is my brother, is my friend, and at the same time is a psychiatrist. Now he's going to tell us more about himself. Brother, you're welcome.
Thank you so much. My name is Francis. I am a psychiatric clinical officer, and about me is where I get what we call a psychiatrist.
Okay.
Yes.
Wow. That is good. Now, what do you guys do?
We treat people who are having mental illness or who are mentally sick. That's what we deal in mostly. That's our profession.
Okay. So when you say that people who have mental illness or who are mentally sick, or when you say mental illness, what does it mean?
Okay. Mental illness is a condition which affects the way you think, the way you behave, affects your judgment, how you look at things. So any condition like that which affects the way you think, the way you look at things or life is mental illness.
Wow. According to what you've said, you say that these conditions or mental illness, it affects the way you think, the way you look at things, and actually we all think. And there is a statement which says that all people are mad, but the degree of madness is different. Because I usually see people, they pick things on the road, they put on dirty clothes. Those people, for us, we call them mad. Is it what you're trying to talk about?
We don't have mad people. Actually, when you go to any hospital which deals with especially treating for mental illness, never said that someone is mad. He said people are mentally what?
Sick. So there are no mad people.
There are no mad people. So when you see someone in a community behaving that way, eating things on a rapid speed, just know that person is what?
Mentally sick. Not mad.
Just like the way you are sick of malaria.
So it is also a sickness.
Yes.
Not madness.
So you should not call them mentally what? I mean mad.
We shouldn't call them mad.
You should call them mentally what? Sick.
Okay.
So you were talking about the degree of madness.
Yeah.
There are different signs of mental illness. And in mental illness, like we look at a set of symptoms. Okay? Now you we maybe have one symptom, and for us we want 12 symptoms to classify that you are mentally sick.
Yes.
For example, when you see me as an animal, or like moving at night, you see some banana plantation or plants like an animal. Okay.
By the way,
like an animal.
I have ever seen that thing several times. Maybe when I'm moving at night, I see a banana plantation or a tree somewhere ahead, and I assume that is someone.
Okay.
That is a person, and yet is not.
That one is called an illusion. Okay?
So that means it is also a sign of mental illness.
It's a sign of mental illness. So you can have that one sign, but you don't qualify. So you may, if you continue seeing that, because mental illness we deal with what? First of all, we deal with the set of symptoms. We deal with the period.
Yes.
Okay. You may want a period of 2 months, a period of 2 weeks, or 1 week, but for you have just seen it for 1 day, so you may not classify it as mentally sick. But if you keep seeing it for for 1 month, you are seeing everywhere you go, you see that as a person,
and yet is not.
It's not. I mean, like you are seeing it as an animal, and other people are not seeing it.
Yes.
So we classify you. We can look at other symptoms. We add you on that one. We say, Wefafa is what? Is mentally sick.
So that statement is true.
It is true in their sense, but in our sense, mental illness, we look at the signs,
the set of those signs and symptoms,
and also the period of time.
Period.
Okay.
So it's not just something you conclude. Maybe you have one sign in 1 day, and then you you say that that person is mad.
Yeah, and each of us have those signs.
We have them.
We have some signs.
We have some
You find
signs.
someone behaving abnormal at one point, but then it comes back to the normal sense. So you cannot classify that one is what?
Is mad. Is sick. Okay. Sorry, I'm used with this statement, but
I know
thank
by the
God
end
that
of this,
you've corrected me, and I think our viewers outside there, you are also correcting yourselves. We have heard that it's not good to call people mad.
Yes.
We say that people have mental illnesses, but they are not mad. Now, brother.
Yes.
What causes these mental illnesses? Because for us, what we know, when we see someone with that problem of mental illness, as you mentioned,
yes,
in most cases we say that he has the spirits. Or in Uganda they say empewo z'ekika, oba in Lumasaba we can say kimisambwa kyesikuukani bibini. And then sometimes also we say that they have bewitched that person, maybe because he stole something, or because he was disobedient to his or her parents. Do you guys have other possible causes of these mental illnesses that you've found out, apart from what we know? And anyway, is that true?
Okay. Just like they are spirits, yes, they are there, but mental illness, there are causes of mental illness. Okay?
Yes.
But we don't have a single cause where we say the cause of mental illness is one, maybe this one.
Yes.
But we have what we call a combination, okay, of factors. So mental illness, we have different factors. There are biological factors, there are physical, environmental. So all these things, they come together and play together and make someone to break down. We call it breaking down when you get mental illness. For example, there are families, for example, can say genes or inheritance. There are some families which you had someone who had mental illness.
Yes.
So when also you find you breaking down, it means because of that history which is there.
Okay, so sometimes this thing can run
Through
in the
family.
families.
Yes, can run through
that
the
means you can inherit it.
Yes.
Okay.
Then another thing is there are these environmental things like you get an accident, your head is damaged, and you start now moving up and down. Then others is our personal being.
Yes.
Like these people who drink a lot of alcohol, your brain is affected.
Yes.
You can break down. You take substances, marijuana, cocaine, your brain is affected.
Yes.
And others are just within ourselves. The hormones. When there is some hormonal imbalances, it will lead you to some kind of mental illness. Yes. And not forgetting the social factors.
Social factors.
You have lost, for example, if you have your girlfriend, you have your wife has divorced you, it will disturb your brain, and if you are not able to contain that stress,
yes,
you break down.
Okay.
Someone loses a beloved one,
yes,
maybe a wife, someone who is so close to you, you break down because you have lost someone important. You fail to cope up with that
someone
stress.
Has been loving too much.
Yes, you fail to cope up with that stress, and you isolate yourself. You break down.
Wow. Me have not been knowing that these things, like as you mentioned, when you lose something and maybe you overthink about that person, or you get an accident, you can get these illnesses. But now I'm glad I've learned something, that these illnesses can be caused by several factors, as you mentioned. And I hope our viewer, you are learning something.
And another thing I can say, that everyone is a potential candidate to mental illness. Like as we look at these factors, you can get an accident and maybe your brain is damaged. You can.
So that means this thing is not for some people.
Yes.
Though we saw that one of the factors it can run within families.
Yes.
But you've also told us that you can get an accident and you become mentally sick. And then all those things, like maybe losing a loved one. And we all die and we lose people we love.
Yes.
So that means we are all potential candidates.
You are potential candidates. So don't call your friend mad. But everyone
is mentally, may be mentally sick,
at
but
one point in life.
You may break down.
At one point in your life.
Okay.
So we have mentally sick persons, not mad people.
Okay. Now, you said that things thing. I know you mentioned about something like about the signs as I was asking you, but are there other things apart from what you told us? The things that you say that for we all have those signs. Can you just help us? Maybe you bring them out. What are some of the signs that I can have to know that I have a mental illness?
Okay. Now with mental illness, it's not like sometimes it's not like malaria, whereby yourself you know you are mentally sick. Okay?
Yes.
But with mental illness, someone else who is closer to you can see that my brother Andrew, this is not the Andrew we know. There is change of personality.
Yes.
So we have different types of, we have different signs where you can know that someone is mentally sick. Some of these people, when they are mentally sick, they are brought to hospital. They don't agree that they are sick because they don't feel anywhere paining you.
Okay.
The thing is about the brain, the mind.
So you will say, I'm not sick.
The mind is sick. So,
actually, is it that sometimes you may say actually people who have brought me are the ones who are sick.
You are sick. So you may find the patient saying that those are the people who are sick, but the mental illness, we have different types, okay?
Yes.
Like these people, you see them moving on the streets. Those are the ones who know that they are what?
They are sick.
They are sick. So you find them talking alone. They are laughing alone.
Yes.
So those people, they have what we call perception. How we have the senses. We have the eyes, the tongue, the nose. How we smell those things. So there are sometimes when you perceive or like you are seeing something.
Yes.
But it is not there in existence.
Yes.
It is called hallucination. Okay. You can also hear things like the voice of someone, but there is no one hearing. There is no one else hearing that.
Hey, you just hear someone talking or singing, but there is no one.
But like these people, you see them talking,
yes,
like moving on the street, talking alone. They are hearing voices of people talking to them, and we call them auditory hallucinations.
Okay.
So those people can hear one voice, they can hear two voices, three voices. These voices, maybe they are telling the patient, "You move away from home." That's why you find those people moving in our community. Say, get a stone, they can look at Wefafa, say, Wefafa is your enemy. Kill Wefafa. Hey. So they are hearing voices. Sometimes you see people seeing things which are not existing. It can be animals, can be plants. But when other people around you, they are not what?
They are not seeing.
Other things, people become restless. Others become talkative. I've ever seen people who are talkative. By the way, there are people who are mentally sick, but they are very smart. They are dressed well, but their mind is what? Is sick. You find Wefafa is dressed very well. It comes to your office and says, I have 10 billion Ugandan shilling. I studied with President Museveni, and it is my hobby. But when you look at the person telling you, he has never been in the there are those kind of people who feel they are very special. Yes. They are ambassadors. If he's in the religious sector, he says, I am the Pope. I'm working with the American government. I can say. We have different types of what? Mental illness. And with different what? Symptoms. Okay. So you may find a very smart gentleman, but his mind is what? Is sick.
So according to what you said, for our viewer to understand, so that a patient someone may start talking to himself, and he may start hearing different voices, and he may see things which other people are not seeing, and many other things. Wow. I think our viewer, you're following these things very well. So are there some types of these illnesses?
Yes, we have different types of what? Mental illness. For example, we have what we call bipolar affective disorder. It is bipolar means two. So we have what we call mania and depression. So you may find someone coming in a manic phase. Someone is a mood disorder. Mood is how you feel. Okay. Are you happy? Are you sad? So you find someone is so much excited, has a lot of energy, is moving up and down, is talkative. That one we call it, you are coming in a manic phase. And those are the people, when they come in the community, you find they are destroying things, they are fighting, and some people even end up beating their wives. You think that person is very tough, yet someone has broken down. So that is in the manic phase. That one you find is fighting. You can even dig from morning up to evening, but the man is not what?
He's not getting
tired. Yeah, he can move from here up to maybe Kampala. And you say, this man has energy, he can walk. but yet the person is what?
He has broken down.
Yeah. So those are the people whom people normally bring to the what? The hospital. But then also in the depressive phase, it is rare. Someone comes, has a low mood, doesn't want to talk to anyone, doesn't want to associate with you. You bring the food, doesn't what?
Doesn't want.
So that's bipolar. Then these people you see who are moving on the streets, putting on that racks, those ones we say they have schizophrenia. And those ones they move, they don't beat anyone, they just move, they talk alone, they have neglected self-hygiene, and those ones can only be tough when you have what? Disturbed them.
Wow.
And schizophrenia can make you, when you have been now like you, Andrew, my brother, you have been very important in the society, but you go on reducing from that very important back to the what? To the streets, to the rubbish pit.
Wow.
So then also we have I'll not forget to talk about substance. There are our younger men who take marijuana, who take cocaine, who take ovacuba. So those things affect the brain, and these people start seeing things which are not existing. Someone can see things are moving in their body like insects, but they are not there. There's one whom my phone says, that I'm hearing mosquitoes are talking to me. Say what are the mosquitoes telling you? It says they are telling me, but they are going to what?
They are going to eject.
They are going to eject you. Okay? So they keep hearing those voices because their brain has been what? Damaged by those substances, alcohol, marijuana, cocaine. Then also we have what we call HIV-induced psychosis. You can have mental illness caused by what? HIV. HIV can affect you 2 times. It can go directly to the brain, or it can use these other infections and affect your brain. So you start hearing voices, you start seeing things which are not there.
So that means when you get HIV, you can also end up with a mental illness.
Yes.
Wow. Our viewer, I think you've heard, and I think our brother still has a lot. I didn't know that mental illness has a lot of types. I think you just mentioned a few, but there are other types.
Others, like we have depression, we have anxiety, anxiety disorders.
Yes.
We have dementia, that one we call disease of the elderly, where elderly people from 65 years and above, they start seeing these things. So there are the other types which I cannot mention because
right now.
Yes.
Wow. But I believe as we shall keep on moving ahead, our people will be able to get all these things, because God willing, we shall be tackling topic by topic, and then until we shall finish these things, God willing. Now, brother.
Yes.
I want to ask something.
You can ask.
Is there any treatment for this mental illness, or when you get it, everything is done, you just have to go?
Okay. So mental illness can be treated.
Okay.
Mental illness can be treated. You can go to any nearest. We have different hospitals where you find specialists who are trained to treat these people.
Yes.
And for example, if you have a mental patient in Uganda, then the easiest place you can go to, we have even health center force, there are nurses, but the best place is you can go to a district hospital.
Yes.
You get help very fast. From there also we have regional referral hospitals, they have psychiatric units, their patients are admitted. Okay? Their patients are admitted, you can get the help, and they treat you. But also we have our national referral hospital that is called Butarika, where patients are so many there, you can be admitted, and they give you the what? The treatment. So you can take the treatment and be fine, you continue doing what?
Yes.
Your normal what? Work.
So that means, viewers, if you have anyone in your community there who has a problem of mental illness, according to our brother here, those people can be treated, and there are hospitals out there so they can get help. Maybe lastly, do these mental illnesses cure?
Yes, we have different types of medicine, and as I was telling you, we have different types of what? Mental illness. So it depends on the type of mental illness which you have what? Developed.
Yes.
The others we can treat you, and maybe say I've given you a drug holiday depending on the cause of what? The mental illness. Others are chronic in nature. But what I can say, all of them can be what? Be treated. So when you have someone who has mental illness, bring them out to the what? The sales facility. These people will tell you that they are fine, but if you see this man has gone away from the norms, is behaving abnormally. This man used to bathe, this man used not to talk a lot. There are these people who just isolate themselves. You see the person is isolating himself or herself, doesn't want to talk to anyone. Bring them to what? The hospital and assess them. We have assessment, and others believe that we have machines which beat the head. It is only the personnel they are trained who can be able to assess them and find out are these people having a mental illness.
Now that means if I, for example, if I was a teacher, but then I get the mental breakdown, as you say, is there a hope that with the treatment I can go back and do my work of teaching?
We have very many people who are getting their treatment and they are doing their work normally. The good thing with mental illness, when they start you on treatment, you are not going to be bedridden for long. You are not bedridden. You swallow your medicine as you go and work, and no one can see on you and they will say, this man, my brother Andrew, is what? Mentally sick. That's the best thing you can with mental illness.
Wow. Lastly, brother, tell us, is there something that you'd like to tell our viewers out there?
Okay.
Yes.
So what
like a takeaway from this topic. Something they should not forget.
Yeah. What I should tell them that everyone is a potential candidate to mental illness.
Yes.
And when we have our relatives, there are many mentally sick people who are in our communities, but because we are not concerned about them, we don't love them. So I want you, the viewers, if you have anyone who is mentally sick, you see someone is behaving abnormally, such someone is isolating himself or herself, bring them to the hospital. They shall find treatment, they shall find qualified personnel who will work, who will handle them. And someone will go back and do things, by the way, in the community productively. So if you have mental illness, one of the definitions of mental illness is that you are supposed to live productively, you realize your ability, and you can do something in the community which is productive. So once mental illness gets you, if you have been productive in the society, you will not be productive. So we want our people to be productive, to be doing something for a living. So we bring them to the hospital, and they shall be what? Treated.
Wow. Thank you very much, Brother Enoch, for your time, and thank you for allowing to come here and to be speaking to our people. We have different people, by the way. We have people in Uganda, we have people in Saudi Arabia who are led by Sister Namakoye Agnes, and then we have very many other people actually who are supporting us. Currently, we've been using a phone to capture our videos, but we are doing a fundraising for purchasing the camera and buying other equipments which will enable us produce better videos. So if you are out there and would like to be a part of this video, part of this fundraising, or part of this project, or part of this journey, I will put a link below there, or I will put a number on the screen there where you can contact me and the email, and we see how you can be part of this journey. Also, if you haven't yet subscribed to our channel, we request that you hit that red subscription button, like and share this video with the people you care about. May God bless you all. We love you.
Thank you for hosting me here.
Welcome.